Welcome to the Beauty Scientists with Dr. Kristy Hamilton and Dr. Roy Kim. Real beauty without the hype.
Really, what's the difference between a neurotoxin and a filler? Why might I choose one versus the other?
Fillers do what they say, they fill. And as you know, if you have a static wrinkle, one that the wrinkle is always there, muscle's not creating the wrinkle. Muscle may deepen it, but the wrinkle's still there, even with a blank expression. Filler is really the best thing for it. The most common areas are the nasolabial fold, around the jowl, cheek enhancement, jawline enhancement or definition. Typically, Botox wouldn't work at all, and in fact, may not even be recommended. But fillers are really great for those areas. So the most popular fillers are HA fillers, or hyaluronic acid fillers, and they do have a couple other chemicals out there. Dr. Hamilton, do you have a preference for any type of filler, any special situation?
I do. I really preferentially use hyaluronic acid fillers just because they are dissolvable in the face. And I feel that's really important for a couple of reasons. One's just the safety factor, which we'll talk about. You're listening to two board certified plastic surgeons who know facial anatomy really well talking about this topic. And even so, we have a lot of respect for blood vessels because people have aberrant anatomy or unusual anatomy sometimes. We know where blood vessels are placed in most people, but there are exceptions. And so I think it's really important that if you were to accidentally inject into a blood vessel, that you have the ability to reverse it. And then also just as time goes on, we do see some filler migration if this is something that you do year after year after year. And so sometimes it's nice to start over. And I think patients also like knowing that hyaluronic acid, this is a naturally occurring molecule. I have it in my body. Dr. Kim, you have it in yours. Anyone who's listening, you have it too. And it's a natural plumper. It draws in water. It's a sugar molecule. And so that's the one I most commonly do in the face non-surgically. And my second favorite does require a small surgical procedure. But if patients need diffuse revolumization, I really love fat from your own body because that's the ultimate natural filler and plumper. What about you, Dr. Kim?
I totally agree with everything you said. Hyaluronic acid is natural. It's found in human bodies. It's in the joints and other areas. It can be melted, which is fantastic just in case you need to. And since we're both surgeons, fat is by far my technically favorite filler, but it does require a procedure. Especially for newbies or for people who don't want a procedure, I wouldn't necessarily recommend, hey, let's do some fat harvesting and filtration and processing and fat grafting in an operating room setting to give you the best results. A lot of people don't want a procedure.
Thank you for joining us on The Beauty Scientists. Be sure to visit thebeautyscientists.com and learn more about modern beauty and connect with Dr. Hamilton and Dr. Kim.